You are listening to A Path to a New You, a podcast about mental health and veterans issues. I am your host, Timothy Zarumsky. I am a therapist located in Madison, Wisconsin. I'm a veteran. I served in the United States Navy from 2001 to 2001 to 2009. I I run a private practice known as New Beginnings Counseling LLC. It's also located in Madison on the east side. My practice has been open for 6 years, but I've been in the mental health field for over 15 years. You can find this podcast, A Path to New You, on Spotify, but now you can also find it on the Apple Podcasts. So if you have an iPhone, all you gotta do is just download the app. Again, you can find this podcast on Spotify and Apple Podcasts. And hopefully soon there'll be other platforms beyond. I'm trying to get it on Amazon and a few other ones too, so more people can listen to this. I do have a Facebook page called The Path to New You, where I will post information on self care and other veteran and mental health information, as well as post a link to this podcast as well. Please like and follow that page. I would really appreciate it. Also, you can please like and follow this podcast. So then you like it and I have a new episode up, a notification will come up on your phone. This podcast is sponsored by New Beginnings Counseling LLC, a veteran and private owned private practice. They are currently seeing patients via telehealth, via Zoom. They do not have a wait list. They currently are private pay and will work with you if they will also work with you. They specialize in anger management, PTSD, depression, anxiety, and addiction. You can call or text them at 608-571-3896 to schedule an appointment. All right, so again, this podcast is called The Path to New You. It's a podcast about mental health and veterans issues, like I just mentioned. I try to educate everyone on mental health issues and veterans issues. I try to do an episode once a week. Each week, hopefully, it's a different topic. I also plan on having guests in the show as well. So if you know someone or you yourself either work in the mental health field, a veteran, or you know someone who's in the mental health field who would be a great guest for this podcast, please reach out. Please ask them or reach out to my to my Facebook page, A Path to New You. You can contact me there. Again, the Facebook page is A Path to New You. It's pretty easy. You look it up, and there should be a picture of a waterfall as the. It's not the profile picture, but it's the other cover picture. So it should be easy to find. Please like and follow, and you can message me there too as well. So if you know anyone or you yourself would like to be a guest, please reach out, and we definitely get in touch and definitely talk about it. I think I have a guest coming within the next week or two. I actually posted a link to this podcast on one of the Facebook pages I follow. It's a private practice platform type thing where everybody reaches out and it's like a network connection thing. And it was a self promotion Wednesday. And I posted this podcast and said, hey, if anyone's interested, please let me know. And so someone reached out. So hopefully in the next week or two, I'll have that person on the podcast. It should be pretty cool. And the more guests, the merrier. I'd really appreciate it because not everyone likes to listen to me talking the whole time. Anyway, um, Did you know September is Suicide Prevention Month? Well, it is. Suicide September is Suicide Prevention Month, a time to raise awareness and discuss this highly stigmatized topic. In addition to shifting public perception, this month of September is used to spread hope and vital information to people affected by suicide. So there's different nonprofit organizations that post stuff, resources, and whatnot. And September is a time where it's like we want to educate those on Suicide Prevention Month. The goal is to ensure that individuals, friends, and families have access to the resources they need to discuss suicide prevention and to seek help. I've gotten some of my information through different nonprofits. So what I'm kind of talking about right now is through NAMI, which is a National Alliance on Mental Illness. They're nationally known. There's also a Wisconsin chapter as well. So they spread mental health awareness, and they do all kinds of webcasts, webinars, and stuff to help educate people on mental health. So, what are some of the warning signs? So some of the warning signs, uh, signs of suicide. There's a few of them. I'm just gonna mention a couple of them. One is the increased alcohol and drug use. There's also aggressive behavior, withdrawal from friends, family, and community. The dramatic mood swings, impulsive or reckless behavior. So, suicidal behavior such as that are psychiatric emergencies. If you or a loved one starts to see any of these, say you see a friend or someone who's, you kind of know if you've been a good friend of them for a while, you kind of know what they are, like what kind of mood they're in and all that. And if they all of a sudden they change dramatically, or you can just notice something's going on, talk to them. Just talk to them, see what's going on. And if it's the point where they're like, I don't know what's going on, I don't know. I feel like I'm just like angry. I'm just mad all the time, and I've been drinking more than usual. Tell them to reach out for help. Help them reach for help. Just say, hey, let's go talk to somebody. Let's go reach out. There's plenty of resources out for that. There's other signs such as collecting and saving pills or buying a weapon. So someone who's doesn't have a gun collection, or they're not usually into like guns, shooting, and all that stuff. And all of a sudden they're like, "Hey, I just bought a gun." What? That'd be like out of the blue. Like, yeah, I just bought a gun. I just bought like a rifle or a pistol or 9 millimeter. Like, what? Why did you do that? There's signs, different signs. Another one is giving away possessions. Like, if you see them, they're just giving away things. Like, what, here you go. There are people who give away things just because they don't need it anymore. But then there's those who just start giving away like everything. Just saying goodbye to friends and family. Like, it's just not, people say goodbye when they meet up and whatnot. But there's other things too. Like, you see like a note, like a text, hey, you know what? You're a really good person, but I gotta go. Then you're like, something's going on here. So reach out to them if you're a friend, a family member. Just reach out to them, see what's going on. Also, you reach out to mental health professionals like myself. We definitely could help in a way. I'll help any way I can. If there's something going on, I'll definitely reach out to that person, or they can reach out to me. There's several risk factors too that may um, worsen the chance of suicide. Research has found that 46% of people who die by suicide had a known mental health condition. Several other factors may put a person at risk of suicide, which includes some of the following. There's just a list of them I just found. A family history of suicide. So if the family there's a history of family suicide, that's a risk factor. That's one of the we asked that in an assessment too, and during intake. That's one of the questions I ask if there's a family history of suicide. Uh, History of substance abuse. Like we all know, drugs can create mental highs and lows that worsen suicidal thoughts. Intoxication, being intoxicated. CDC indicates around 1 in 5 people who die by suicide had alcohol in their system at the time of death. Access to firearms. Always, if you have a gun collection, make sure it's locked up. Make sure it's locked up in a key or there's a code to lock it up. Make sure you're the only one who knows the access, who has the key or the access code to it. A serious or chronic medical illness. Gender is another one. Although more women than men attempt suicide, men are 4 times more likely to die by suicide. History of trauma or abuse. Prolonged stress. What does that mean, prolonged stress? Uh, Stress is normal, but if you have it over a long period of time, that can create a risk factor for it. And there's ways where you can help out with that stress, like minimize it through self care. I've talked about this in other episodes. Self care is helps with stress. Self care example would be, I don't know. I like watching sports. Sports is my self care. Going to sports, watching sports on TV, working out, exercising. I have a Peloton, so I use that for self care. A recent tragedy or loss. So you lost a loved one, someone like in your family, that could be a risk factor as well. And there's ways you can help support someone who's in crisis. Friends and family are often caught off guard during that time of crisis because your friends and family are like, "Whoa, what just happened? What is going on?" You're like, "This is not usual." So they're kind of off guard. Some are unprepared and unsure of what to do at that time because you're caught off guard. You're like, What do I need to do to help this person out?" The behaviors of a person experiencing a crisis can be unpredictable, changing dramatically without warning. So, here's a few things you can do to approach a suicide related crisis. Talk openly and honestly. Don't be afraid to ask questions like, "Do you have a plan for how you would kill yourself?" I ask that if someone says they're feeling suicidal. We ask, "Do you have a plan? Do you have a plan on how you might kill yourself?" Remove means such as guns, knives, or stockpiled pills. If you can, just remove everything. That way they don't have the access to it. Ask simple questions like, "Can I help you call someone? Do you have a therapist that you talk to? Can I help you call that person?" That could be a question you could ask. Just to be a direct question. If there are multiple people around, have one person speak at a time. If you're in a group of, if they're friends, if you're with friends and your one friend is um, feeling suicidal, it's a struggle when all of a sudden you got 3 other people talking all at once trying to help that person out. Have one person talk at a time. That would definitely help that situation out. Express support and concern. Say, "You know what? I want to be supportive. What could I do to help?" Don't argue. That's the last thing you want to do is argue with someone who's feeling suicidal. Threaten or raise your voice because that just makes things worse. Don't debate whether suicide is right or wrong. That's not a debatable question right there. That's not debatable. The person's feeling it right now. It's like, "Oh yeah, you're not feeling it." Don't be doing say anything like that because that definitely makes things worse. If you're nervous, try to not to visit or pace around. So you could be nervous because your friend is feeling suicidal. Try to remain calm. Take a few deep breaths. Even that person who's feeling suicidal, just have them take a few deep breaths. There's this. I've talked to my patients, clients before, and just do a breathe in for like 5 seconds and then breathe out slowly for 5 seconds. That definitely helps. Be patient. Being patient is another one. Just be patient with that person. That person is going through something right now. Always, if you can, if that person does have a mental health professional and seeing a therapist, contact that therapist if you can, even if it's left through a voicemail, contact that person. If they don't have a mental health professional, help them find one. I am a mental health professional. I'd like to help any way I can. Um, so yeah, find a contact a mental health professional. A mental health professional is someone with at least a master's degree and also gone through a ton of training um, after their master's degree. In order to be a therapist, you have to have at least a master's degree, 3,000 hours of training, so that's 2,000 hours of client contacts and 1,000 hours of case management. And so they got training. I've been trained. There's therapy. We do therapy as a mental health professional. Cognitive behavioral therapy and dialectical behavior therapy can help a person with thoughts of suicide recognize ineffective patterns of thinking and behavior, validate their feelings, and learn positive coping skills. Suicidal thoughts are a symptom just like any other. They can be treated and they can improve over time. There are several resources out there too, as well. Like I mentioned, reaching out to a mental health professional. I know a lot of mental health professionals, therapists, and whatnot, they have a 6 month waiting list or a year, even going to a nonprofit clinic. They could have a wait list. However, do not have a wait list. I know how many times I've said this to people, even on this podcast. I do not have a wait list. Yes, I am private pay, but I'll definitely work with you. I'll even come to you if needed. Again, I'm based in Madison, Wisconsin, and I'm seeing people currently virtually. Again, if you're feeling or you know someone who's feeling suicidal, you can call or text 988. That text thing or call number is just recently been new number. I think it's about a year old. If that, call that number immediately if you're feeling suicidal. If you are uncomfortable talking on the phone, you can chat the Suicide and Crisis Lifeline at 988lifeline.org. You can also text NAMI, NAMI, to 741 to be connected to a free trained crisis counselor on the crisis text line. If you're a veteran, there is the 1-800 number as well, and then you press 1. But I think with the 988 number, you just got to press 1 after the tone or something like that, too. Oh, yeah. So the veteran crisis line is one for veterans. Um, so usually call or text the number 988. It usually goes to whatever your area code is. So, for example, mine 608. 608 is Dane County, so I'll go to the Dane County crisis unit, which is actually just down the road from me. I used to work there. I worked there for about 6 years, and they have a telephone line. They have several people on at the phone, 24 hours a day, 7 days a week. So yeah, those are some of the crisis resources. There's many other resources out there. You can also reach me at 608-571-5893. My mind just went blank all of a sudden. Like, what is my number? There's other resources out there too. Yeah, there's other resources. You just can go online, Google a help or crisis resources. You can Google it, and there's a bunch of information that'll come up. So my number is 571 So again, 608-571-3896 is my number to my private practice. You can call or text that number if you're looking for a mental health professional. All right, now another thing I want to talk about are there's different facts about stuff I want to talk about the suicide prevention. So we're gonna go over that. And I'm just gonna talk about a few facts and whatnot. So some facts about suicide during the Suicide Prevention Awareness Month. There are several facts that are put out through different organizations. Some of them I kind of talked about throughout this podcast, so some of them I might have repeated. But although more women than men attempt suicide, men are 4 times more likely to die by suicide. I think I did mention that earlier in this podcast. Transgender adults are nearly 9 times more likely to attempt suicide at some point in their life compared to the general population. 46% of people who die by suicide have a diagnosis mental health condition, but research suggests that 90% may have experienced symptoms of a mental health condition. Let me repeat that. 46% of people who die by suicide had a diagnosed mental health condition, which means they're diagnosed with a mental health illness. But our research suggests that 90% may have experienced symptoms of a mental health condition. So 90% of those who are diagnosed may have experienced symptoms. They had like symptoms of a mental health condition. The highest rates of suicide in the US are among American Indian, Alaskan Natives, followed by non Hispanic white people. 79% of all people who die by suicide are male. I think I did mention that before too. So a few of those I did talk about earlier in this podcast. Again, I want to mention September is Suicide Awareness Month. I plan on posting more stuff about that on my Facebook page, A Path to New You. Again, it's on Facebook, a Path to New You. I'll post a link to this podcast on there so you can find it. And when you click on the link, it'll go right to this podcast. Please like this podcast and please follow so when I do have a new episode up, the phone will give you a notification that I have a new episode up. Please tell other people about this podcast too. I'd really appreciate it. The more people who listen, the more I can educate, more people I can educate on mental health and veterans issues. So, like I said, I try to do one every week, and every week's a different topic. I do plan on having guests in the show as well. I think I have a guest coming up here. I've been talking to someone, emailed someone, and we're kind of trying to figure out like when would be a good time to do that podcast. Again, I use Zoom for my podcast for the guests, so you don't have to go anywhere. You can be at home, and I'll send you the link, and then we can discuss over Zoom. Zoom has worked in the past because I've used it for other. I had a co-host here for a while, and Zoom does work, so no need to go anywhere. So you could actually live anywhere in the country, actually probably much anywhere in the world. If and I gotta do is send you a link to the Zoom. I believe this person who's going to be on my show is from California. She does codependency and anger. And she's an LMFT, which is licensed marriage and family therapist. So I've been talking to her last couple of days, and hopefully, I think next week or the week after, we'll have her on the podcast. Again, this podcast is called The Path to a New You. I do have a Facebook page called The Path to a New You. Please go to that page. Please like it and follow. If you are in the mental health field and want to be a guest on this show, or you're a veteran, or you work for a nonprofit veteran organization, or you know someone who'd be a great guest on this show, please reach out. You can reach out through my Facebook page, A Path to New You. You can message on there. You can also send me a message through my phone number too. It's 608. My counseling practice phone number, 608-571-3896. You can text there, and then we can figure things out. The more guests I have, the better, because not everyone wants to listen to me every week. It's nice to listen to me, but I'd like to have other people on the show as well. I hope you all have a great rest of the day, and hopefully next week, we'll be talking again next week. Again, be well, be safe, and enjoy the rest of your day. You are listening to A Path to a New You.